Now, the UK has reported another 1,041 people have died from COVID-19. It's the highest death toll since April. Over 62,000 positive cases were recorded as MPs debated the new national lockdown restrictions. The country is racing ahead with its vaccination campaign, aiming to give 14 million people the jab by mid-February. But the situation in hospitals is desperate, with medical staff on the National Health Service bearing the brunt. Well, Tadhg Enright spoke to one of the doctors on the front line.
On Sunday, ambulances queued outside the hospital which treated Boris Johnson for coronavirus last year. In the week before the Prime Minister announced a new lockdown, the number of people treated in English hospitals rose by a third. David Oliver is a consultant physician in one of them.
It's already as bad in terms of numbers as it was in the spring, in the peak in March and April. And we know it's probably going to get worse over the next 2 weeks before we hit the peak.
And how quickly have things changed?
On Christmas Eve, I was at work and we had about 75 people with COVID in the beds. And by the bank holiday Monday, the 28th, 29th of December, we already are up to 170. The good news is we've got better personal protective equipment. We've got more testing, so we know sooner whether people have COVID. On the other hand, people are tired. We've been looking after sick people with COVID now from March. People have had colleagues who've got sick. A very good friend of mine in medicine who was only in his early 60s died yesterday from it. I've had other colleagues die.
The new lockdown was triggered because of expert opinion that the health service was at risk of becoming overwhelmed.
We know we can cope because we did it before, but on the other hand, people are tired and they're burnt out and they're seeing a lot of traumatizing things, and a lot of them have got sick themselves.
Staff are dealing with the new variant, which is up to 70% more transmissible, and new symptoms.
We do see an awful lot of people who don't get that breathless, but they've got diarrhea and vomiting, and I'm seeing lots of that at the moment with the new variant. Maybe poor nutrition, maybe dehydration. The older people get very confused with it. We do know an awful lot more about how to treat it, though. We're not picking the same people for ventilation that we picked first time round, because we've learned more about who's likely to benefit from ventilation. And we have more people on this non-invasive ventilation. So we've got more of a knowledge base about how to manage it. But you still get so many people who are on oxygen for so long. And some hospitals, it's really putting a strain on their oxygen supplies.
David is relieved with the lockdown, but knows mistakes have been made.
We never did what the more successful countries did, really aggressive early testing and tracing. We've dithered too much. We've been late to the party. Think about how COVID is transmitted. It's surfaces that people have been touching. It's airborne transmission in poorly ventilated enclosed spaces. It stands to reason that the more people we have mixing in enclosed spaces and not wearing masks and touching the same surfaces, the greater the transmission. The other thing to say is it's a really false dichotomy between the economy and jobs and the pandemic. But if you have an unchecked pandemic raging through society, putting people off work, incapacitating them, it won't do the economy any good.
Over the next 7 weeks, we'll see whether lockdown and vaccination will make life easier. Tadhg Enright, Euronews, London.